So we're offering free healthcare to students under the age of 21, so that all students in Oregon can go into a health center that are located in schools and have access to health care.
What about the parents?
Parents, there's less of a coverage for parents, but there's family plans that they do.
Family plans?
Yes.
Like, what does that entail?
I'm not sure how much of a family plan, like, my friends, when I use the health center, it's just for the students, but, like, if there's substance abuse issues with families, we do family counseling.
And birth control?
Yeah.
Okay, so you guys are promoting birth control inside the school.
That's one of the things that we have access to.
What kind of birth control?
Any kind.
Abortion?
No. Because it's just a clinic. So you
Morning after pill?
I think that there's
I
this
believe
application process. She'll get somebody to answer your question.
Okay, so this little gal can answer my question.
Oh, she can if she. I didn't know she might.
You know the answer. Yeah, so the regular program is going to push birth control inside the school.
No, it doesn't push. I wouldn't use that word at all. What we do is we follow state guidelines. So there's state laws. Actually, I wish I knew the state law number, but it's 1973 where our state legislature said anybody of any age can access reproductive health care. Regardless
Now,
of
would that be without notification of the parent?
right, and it's a state law.
Well, okay, what if,
Give them an aspirin.
yeah, you
No, we can give them an aspirin as well.
No, ma'am, I've been a volunteer in the school.
So there's a big difference too. There's a big difference between a school nurse and then a clinic inside the school. So it's a very separate. So there's two.
So you can offer condoms and stuff like that.
Yeah, it's you know.
Are we gonna offer meals for kids that are heroin addicts?
Well, that's true. Yeah, and so it's
I
basically
have a real problem with the parents.
No, but let me finish. It's up to the school board to decide what happens inside the school. So in Portland Public Schools, the school board said yes, we want full service for our students. In David Douglas School District said we want full services for students with the exception of dispensary birth control. So in David Douglas School District, they have decided for their what's best for their own community. In Canby, they've made different decisions. So it's based on so it's really up to the school.
Okay, and so it's kind of
You go run around the lab.
Oregon.
We have 60 clinics throughout the state. They
And who
are
provides you with money?
a variety of funding streams. We get federal
Money
grants.
plans are.
No, we actually are very separate from Planned Parenthood. They're a completely separate organization. We actually don't work with them at all. They do come into the schools and community and provide education and on the school and on the community. So it's all really based on the local
What percentage do you think is related to sexual activity?
Well, the data I can tell you is that the number one reason that students come to our health clinic, and I'm just talking for Multnomah County. I'm not sure what community you live in.
I live in Salem.
Okay, so a very different community, very different beliefs. I would say.
What do you mean? I don't quite, ma'am, I don't quite understand that.
No, it's just different perceptions of what is, different political,
So there's a political element to this. Well, you just said there was.
I'm talking about the views of the community, ma'am. I'm not talking about So the views of the community are different. So the community is what guides what we do.
And who's the community? You keep talking about the community.
Parents, school board, teachers, people that work with children. The community at large is final on the school.
Oh, yeah, you're being very vague when you're trying to describe the community.
Has to be on board because the idea in the school district, the school board has to be.
Where's the parental?
Well, let me explain. So in Multnomah County, and I can only speak for Multnomah County because that's where I work, in the high school, 82, minutes of the kids that come in for visits we have some level of parent communication. And maybe
I'm trying to.
I know if you did not interrupt me, I would answer your
Okay,
question.
I'm sorry if you're interpreting as interrupting. I'm just trying to take it.
So in Multnomah County, we have 82% of our high school visits have some level of parent involvement, which means the parent attends an appointment with the student. We get the parent on a speakerphone and have a conversation with the student in the clinic so we can inform the parent about what's happened. So we're sending medication counseling. And our goal in the county is to involve parents as much as possible. However, there are times when the parents are part of the issue. Not everybody has parents in their home. Not every student even has a home.
Yes. Thank you for answering my question.
So, not every student even has a parent in their own home. They live with their friends. So we have to adjust our services based on the needs of the student.
Okay, you said something very interesting. You said you send medicine home with kids.
Yes.
Okay.
A kid comes in with strep throat. We provide them with medication.
So do you have a doctor that prescribes the medication?
We actually have nurse practitioners and nurses, and
So
we have
you do the strep test right there? What about pregnancy tests?
Yep, we do pregnancy tests, we do STD testing, we treat reproductive health like any other service we provide.
Okay.
We know we've done surveys with high school students, but we know like 50% of high school students by their junior year are really out here. We can't
Why do
avoid
you think that is?
It's not changed that much over the last 20 years. That's been a pretty steady data point. So, it's the same as when I and these laws to provide reproductive health care without parental consent, it doesn't guarantee the student doesn't have some kind of parental involvement. It allows them to come in and ask them. And then what happens after that? Occasionally we have nurse practitioners that say we can't keep this confidential. We're worried about it. So we have it's not a one-size-fits-all when students it's sort of a testing situation.
Okay, I understand that entirely. But the problem, I guess, I see here is I have a daughter. She comes in and she's pregnant. Okay, and I need to know that as a parent.
But it doesn't guarantee your right to that.
Yes, it does. I provide for that child until she's 18 months. Wait, I don't care about laws. I'm talking about moral laws. I'm talking about she's my
we all have
daughter.
different moral laws. You can't.
Really?
I'm pretty sure that we have different morals.
Oh, I'm sure we do. But the thing of it is, the moral that I go by is that child till 18 years old is my responsibility. I don't want the school having jurisdiction over my child. That's my duty as a parent.
And we always encourage students to talk to their parents, involve them at the highest level possible.
So my daughter comes into you folks and she's pregnant. She goes, I'm scared, I want an abortion. And you're going to refer her to an abortion.
Actually, we don't do that. That's a service we don't provide. We have agreements with the schools that we don't. What we offer them is option counseling by a registered nurse off of school campus if they want that.
School campus, like Planned Parenthood.
We don't talk about it. It's something we've agreed with the school district. It's very complicated. It depends on what other services. For example, in Portland Public Schools, they have key parent advocates. So if we have that way, we refer them to the school team to assist her in talking to her parents, involving her parents, and getting her services.
Okay.
That's how we.
You've given me quite a bit of your time. I appreciate it. I do disagree with you. I'm
very sure of that, yeah.
Really. I am very, because I've been so involved with my children.
And that's what we want. Ultimately, we want people like you. Yeah.
But I agree that, the thing of it is, if you're a child, go get an abortion. There is no support for that child.
And that we don't do that. And that's one thing we don't do. We connect them with community health nurse. They have a nurse that can walk them through their choice. They have a choice. They have reproductive health choice. And under 18,
Are you trying to push that 18 and lower?
Oh, 40 years.
before I